We are live, ladies. Hello, everyone. Thank you for joining us. We are the Millionaire Ladies Mob, and today we have a great topic because it is very timely,
On
and
time.
it is timely for those people who are turning 65 and those people who are not. We're going to be concentrating tonight on those people that are under 65 and are who are eligible for the marketplace. Okay, so before we get into that, we're going to introduce ourselves. My name is Aaliyah Sherrod. I am out of Southern California, and I am excited to be here. You can reach me at aaliyah10k.com. I do all things health insurance. I am the healthcare queen, but I also do a lot of other things. But tonight, I'm going to be talking about with my associates about healthcare. Carmen, introduce yourself, and then Shalonda. We're also missing Saran. So she has another commitment, so she won't be here tonight. But it'll be us three, okay? And welcome, Carmen.
Welcome. Thank you for joining us here on the Millionaire Ladies Mob. We're here every Thursday night at 8:30 p.m. Eastern. As Aaliyah said, we have a timely conversation. These are things we need to know, and sometimes they get overshadowed by whatever else is going on in the media or in the world. The things we really need to know is not out there. The information is not out there. So we're here tonight to give you some guidance, whether you're under 65, over 65, or know someone that's under 65 or over 65. I am Carmen Bernard. You can reach me at carmen10k.com. I do everything life and health. So protected income, ensuring that you're completely covered, um, retirement planning, reducing taxes, and creating generational wealth.
Thank you.
And I
All right,
pass the mic to my
pass the
colleague,
mic.
finance coach Shay.
Good evening. Good evening. Let me make sure everything's turned down low. I got like 15 different networks up here on my phone. I am Finance Coach Shay, and I am here to be sure that all of your finances in order so that you can afford the things that you need in life, the health care, the life insurance, whatever, that may be, the retirement plans, the annuities that we talked about last week. I can be found on all social media platforms as Shalonda Kaiser Mitchell. You can follow me on TikTok at Finance Coach Shay. And I'm so excited to be talking about healthcare because open enrollment's here. It's here, right? So tap in. I did put on some of my pages to tap in with all of your finance questions because we will be watching, or no, your healthcare questions because we will be watching the chat. Thank you, Leah.
Thank you, guys. Thank you. You know what? I want to give a little history about how this came about. Before 2010, when you wanted health insurance, one of the ways to get it was you had to have a job, and your job offered that to you. Or if you tried to get an individual plan, you had to be healthy and you could be declined for health insurance. I remember this. And the reason I remember this is because my husband was sick and we were trying to get health insurance on him. Even though I had group insurance, we were trying to get health insurance on him. He couldn't get it. So I had to keep him on my plan, and his needs were a little bit different than mine. So in 2010, when Obamacare came out, it was just, I was so happy. Now, some people, when you think about Obamacare, it's the Affordable Care Act. That is the correct term for it. And most of us know the term Obamacare. So what Obamacare promised, and one of the key things of Obamacare was that you could get a health insurance plan and not be declined. How huge is that? It's
Yes.
really huge. And the reason it's huge is because there were people who you could have had back surgery, a heart attack, and you could be okay. But when they went in and decided you couldn't get insurance, you couldn't get it. So there were a lot
Right.
of people that were uninsured. Do you remember that time, Carmen? Do you guys remember that time?
Yeah,
Okay,
definitely.
good.
People couldn't get insured if they had any pre-existing conditions at all. And although there was so much political turmoil around this particular legislation, the fact of the matter is that millions and millions of people were helped with this. And although this has happened, we still have millions of people walking around uninsured that can be insured. And that's why we want you to tap in tonight, because there are people that are working, but their jobs do not give them insurance, and they do not understand that they can get insurance on their own. And one of the reasons, or they think, insurance is so expensive. They know what, if they've ever had it with an employer, they complained about what they had to pay, not even realizing that they were paying about a quarter or a third of what the employer has to pay. Right. And so because of they knew that $200 came out of their account just for them, they're like, well, you know what? I'm just going to keep my $200. I'm young. Nothing's going to happen to me. You know how we are, right? We're invincible when we're young. Nothing can happen. And we end up walking around without insurance. Well, I want you to tune in today. If you have a job and your job does not provide insurance, this is the time for you to be speaking to Aaliyah, to Coach Shay, to Carmen. This is the time for you to be talking to us, because there is affordable healthcare out there for you. Keyword affordable, because there's so many tax credits that they allow you. And I'm going to let Aaliyah and Shay talk some more about it.
I just want to say that I'm not that young. I actually do remember that. I actually used to work for, I can say their name because they're not going to sue me, for United Healthcare when I was in college. I paid medical claims. And there was a lady that worked there with us, and her husband was a pastor, and they made decent money, but they only had, at this time, 3 employees. And so she had to get a job. She had to come back to work because they lost their health care when they switched their church. So they used to be under a big umbrella of churches, which was run like a corporation. And so they had health care. And then when he went on his own with his ministry, him, his wife, and his secretary were the employees. They no longer qualified for that health care, so they got dropped. She had to go back to work because he had health conditions. And the only way she could get him covered at that time was through the group insurance at her job. Although they did give him a higher tier because of his pre-existing conditions, which we'll get into, that's the difference now. She had health care. So it was crazy to see this lady that was in her retirement age that had to go back to work to get health care. So,
and you know what?
Crazy.
You touched on something there that I must say. There are where I worked as a teacher for more than 15 years with DeKalb County Schools. And there were people there that worked only because they needed health insurance. Their family had a business, but they couldn't afford to have insurance anyplace else. And so they were working just because of the health insurance. People in retirement often go back to work, even though they want to be retired, but they often, especially in full retirement, where now it's not going to affect their benefits, they go back to work just so that they can have, health insurance or, things like that. Especially people that have been self-employed all their lives or something, and they didn't pay in enough. And we're going to get into Medicare in a little bit and all that, what you have to pay into and how you qualify. But that's the reality of the situation. And I'm so glad that we are here talking about this, because I'm sure we're going to help some people tonight.
I know we're going to help some people tonight, because there is a false sense of thinking that insurance is too high. Well, too high is relative.
Exactly.
So let's talk about that. what happens when you don't have health insurance and you go into the emergency room? They look at you because the first thing that they ask you for when you walk in the door, when you go online, when you make an appointment, is who is, can I have your health insurance identification card? And that dictates whether you'll get treatment. Now, there are laws passed that say they have to treat you, but they can treat you and let you go. And then if you are sitting there worried, I don't have any health insurance. I make $60,000, $70,000 a year because I'm a business owner. I'm talking to the business owners out there. You self-employed people, you people that do Uber, people that do Lyft, people that have small businesses. There, you have a wonderful opportunity in front of you right now because the Affordable Care Act brought about subsidies or tax credits. So when we talk about that, subsidies and tax credits, that means that you get a subsidy to pay your insurance premium every month. Now, you don't get it personally, the insurance company gets it. And
Right. So
that
they
is
can charge you less. So
that's
they can.
right. And when people think about it, they say, well, do I? And I am educating people every day, and it astounds me about that they don't understand and they still don't know. And we have had this 10 years.
Right.
And the thing is that we want to make sure that you understand that the subsidies that are available to you. And then on top of that, in March of 2021, President Biden extended the subsidy eligibility for higher income earners.
That's
Now,
right.
you know what? And that is key because a lot of people, because their income was over a certain amount, didn't get enough credits or even a tax credit for
Or
them.
any at all. Right.
Right. And so I want to make sure I have a whole outline to go over with things. And then I'm going to give you just a quote. I want to do a quote so you guys can really see the effect that these tax credits and these subsidies have on your insurance premium. Now, I'm not going to tell my age, but my health insurance is paid through an employer. My health insurance is $1,200 a month. I have a high deductible plan. So just think about that. If you were single and you had to pay $1,200 a month plus a deductible plus out of pocket, and I want to go over all that because this is how we're going to guide you to pick an insurance plan.
If
So,
you told us your age, we wouldn't believe you anyway.
well, thank you,
Yeah, we
thank
wouldn't
you.
believe you if you told us your age. But I can't wait for you to go over this because when President Biden made that change in the health insurance that made it even more affordable for people with higher incomes, we had a 18-month long open enrollment, and people still
Right.
didn't know and still didn't take advantage of it. But when Aaliyah goes over that, I'm going to give you an example that I know for real that I worked on with one of my family members who before would have had to pay about $800 a month for themselves. And then
Wow.
once that went in, something changed. So tell us tonight if you've ever heard that the laws changed so that you can get more affordable insurance. If you heard that, put it in the chat and let us know if you knew about it, because we were busy listening to the pandemic and listening to who's running and listening to, and we weren't getting information that you really needed to make good decisions for yourself.
Right. And if anything, if the pandemic taught us anything, it's that you need health insurance. Those with health insurance, they got care, but it wasn't the best because everybody was in the hospital. Everybody was trying to see a doctor. Everybody was sick. The waiting times, you go to the emergency room and they made you sit outside. But when you have health insurance, and there are a lot of benefits to having health insurance because a lot of the bills toward that had COVID related bills, they waived a lot of that stuff. But what we're going to talk about, let's go back over the basics. So I want to start from the beginning. We talked about when it started, 2010, and I was able to get for my husband what we called a pre-existing condition plan. That's what it was called. The deductible was like $100. The premium was like $200. It was just 80/20 PPO plan. It was the best plan. And then they phased in all these other plans and all these other changes, but we were able to have a really, really good individual plan. And we moved to Arizona, and he had a PPO, so he could go to any doctor. Now, the marketplace, what it's called is over in California, it's called Covered California. In some states like Texas and Atlanta, I'm sorry, Georgia,
Georgia.
not New Jersey, I'd say not New Mexico, there are a lot of exchanges coming up that are state run exchanges. So the federal marketplace was the first one, and Covered California had their own marketplace.
All right.
So,
So some states, if you're listening to us, some states have their own marketplace, and some states are is guided by the federal. So and Georgia would be one of them. Do you know, is your state in the federal as well?
Yeah, Missouri and Kansas, since we're neighboring states, and
Mhm.
I go to the doctor in Kansas actually, even though I live in Missouri, because
really? Okay.
yeah, then but it's because of the network. And I'll get to that as well. How some of the doctors, when you start talking about it, I'll talk about how some of the doctors didn't necessarily agree with how they were going to get paid, so they pulled out and start their own networks.
Yes. Now, you know what? In California, when Covered California brought out the plans, now here's how it works. You have a single person, and they go by your actual income. So if you're a W-2 employee, your income is what they base what your premium is going to be and what your tax credit or your subsidy is going to be. Now, do I need to break it down just a little bit more, or you think that's
I
because
think that's
tax
sufficient.
credit, subsidies, when you hear all that stuff, you're like, okay, somebody giving me some money.
Right. And subsidy basically means somebody is giving you some money, but not you personally in your hands, but some credits going toward paying for your plan. And you know, one of the things, but because of all of the misinformation that goes out, and I have to say this, because what happened is some people thought that this Obama plan it's a public plan and it's not going to get you proper treatment. Did you hear a few minutes ago when Aaliyah said it was an 80/20 plan? It works just like your employer plan would have worked when it comes to PPO. And then there are HMOs where it's just one network that you have to go in network in order to get treated. And most of you understand HMO and PPO. Well, the ACA, the Affordable Care Act, quote unquote Obamacare, works exactly the same. And it's the same doctors. They didn't go conjure up some doctors that never went to medical school and put them in this plan to treat you. So people were saying that I don't want that Obamacare plan, just like last week I told you, I don't want an annuity when you are getting a social security check every single month, but because of miseducation, that's what happens.
So how about when you get the person that says, I don't want that, because I used to teach healthcare to some of the soldiers, right? As they were transitioning. And, when they're transitioning from the military, they're leaving TRICARE. And so they're going to have to get.
Really?
Yeah.
Depending on how they're leaving. Yeah. Depending on how they're leaving.
If they're not retiring out of the military, or either medically or retiring, then they don't keep TRICARE. They only keep TRICARE if they're retiring.
Wow.
If they're transitioning out medically at a certain percentage, then they can have TRICARE still. But if they're not, then they get health insurance. So there's this big rumor, and that's what it is, or misconception, that when you get out of the military, you can just go to VA and take care of everything. That's not true. If you go to VA for a common cold, the VA is going to send you to your primary care physician. They're only going to help you with whatever treatments or whatever injuries you had while you were in the military, unless you're a veteran, meaning unless you're on TRICARE still. And then sometimes they'll still send you to your primary care physician. So just because you're a veteran or you were in a war or whatever the case may be, well, as many wars as we have, everybody's been in a war, then you can go to, you can go to the VA based off of what, issues you had while you were in the military. But so I used to tell them, when you get out of the military, you're going to have to get health insurance. So we would explain to them the different types of health insurance. We give them a big briefing, a 6-hour briefing, and we go over finances, insurance, all of that stuff. So when
wait a minute. 6 hours?
The military is the only company, because it is a business, the military is the only business that you can quit or get fired from, and they will make sure that you have everything that you need for your next job. They make sure you have a resume. They make sure you have jobs lined up. They make sure you have health care. They make sure you have finances and that you know how to roll over your TSP. I tell my soldiers that all the time. They're the only company that cares, because when you go out here in corporate America and you put in your 2 weeks notice, they're not going to say, let me see your resume to see if you're prepared. They're going to be like, bye.
Wow.
Seriously.
I did not know that.
Being a counselor for the soldiers was a huge wake-up call for me. I'm like, why would you leave? Some of them were a little forced, but why would you leave? But anyways, on to healthcare. So I would talk to them about healthcare, and this was around the time, with Obamacare, because I'm not as young as everybody thinks. It's the oil of Olay. People think I'm so young. And they would say, I'm never going to get that plan. Say, okay, so before you went into the military in your hometown, what provider did you have? What provider was big there? And the first thing they say, Blue Cross Blue Shield. Oh, Blue Cross Blue Shield, okay. What doctor? They say doctor. Oh, okay. Go to the marketplace, look it up for them, put in a zip code. Oh, guess what? Your doctor is covered under that plan. And then they're like, oh. So like Carmen said, they didn't take the medical school doctors out of medical school that were barely passing and were like, hey, we're going to give y'all jobs over here with only Obamacare patients. That's not how that works.
Well, wait a minute.
You only service Obamacare clients. If
Wow. But that's very interesting, because I didn't know that. But when Obamacare came about, I do remember when we first started it in California, and I'm speaking from California, and I am speaking from experience.
Right.
When you had an ID card and it said covered California, even the doctors were afraid. They didn't know what to do. And as the time went by, it's like, wait a minute now, we need to take this plan, because at least the people are covered. At least we'll get.
I don't understand why they didn't know what to do, because
it was difficult.
But that's the thing about insurance. That's what I love about insurance. Everything is in black and white. You know what your plan's going to cover. You know the percentage that you're going to have to pay out of pocket. You know all of that up front. Right. That's what I love about insurance. There's no negotiation. Well, you can negotiate later.
You can negotiate. And there's one more thing that happened. People were getting what we call surprise medical bills. So you'd go to the emergency room, you'd get seen, and then you'd get a bill from somebody you don't know, and they're not in the network. So now there had to be a law passed.
Yep.
Surprise medical bills. They're illegal.
Look in your fine print, because it's a thing and it's in there, and they will, not trying to say that they're all crooked, but you will get a surprise bill. Yep. And your insurance company sometimes will decline it, and you'll have to pay for it, and you won't even know why if you're not informed, which is why we're here, the Millionaire Ladies Mob, to keep you informed. And you can always visit us at millionaireladiesmob.com.
Thank you. So let's go. Now what I'm going to talk about, we're going to go back. We're still talking healthcare, but what does it mean if you become eligible? Do you have to make money? Do you have to have an income? What is the income? Who has to be in your household? So there are a lot of things. There are basic rules when you are applying for health insurance on the marketplace. So Nevada came up with their own marketplace. Every year, now this year, I have spent literally days and weeks on the certifications for about 20 states, different certifications, ask the same doggone questions, the same thing, the federal marketplace, Nevada, New Jersey, New York, Oregon, Idaho, Washington. It's pretty much the same basic things and items, and making sure we take care of your personal health information, and making sure we do all these things. But it all comes down to the same thing. You as a consumer, you want insurance, you have to follow the rules. They include people who are married, legally married, and you have to file taxes together. You cannot file taxes separately. That is one thing that came up. There are a lot of people, including myself, who filed taxes differently. When I was married from my husband, I filed as a different married filing, whatever. I forgot what it was. But when you want a tax credit or a subsidy on the marketplace and you are married, you must file a joint tax return. Okay, that's one of the rules. If you are married and you have 2 or 3 children, when you are applying for the marketplace, and let's say you have 2 children and maybe one child has a spouse, has a parent that you're not married to, whatever whoever is on your tax return, that's what you have to put on the application. And in the beginning, what happened was people would put themselves on the application and their children. Now, based on the income, so there are income guidelines, and I'll go over them. It's called the federal poverty level. And there are charts that list 1-person household, 2-person household, what the income guideline is. But what happened was, because the government wants children to have health insurance, they made it that when you applied for health insurance and you were a couple and had maybe 3 children and your income was probably $65,000 or $70,000 a year between everybody, your children were sent to Medicaid or Medi-Cal.
Right.
People were freaking out. They did not want their kids on Medi-Cal or Medicaid. Medi-Cal is in California, Medicaid is other states. They did not want their children on that because they were used to a group insurance plan where they could go to any doctor. Now, Medi-Cal and Medicaid is not that bad. It's free.
Right.
Well,
here it was called
some
Peach.
states it's free.
It's called Peach Care or something like that.
Here in Missouri, it's not free.
For
but
children.
In Missouri, they still just force you on it, though.
For the children, though, it's not free under a certain amount.
Okay, so I'm going to have to do some research on that and run a couple of quotes.
It's crazy.
When you're income eligible,
right?
You go into the Medicaid, it is not free.
No. When you're income eligible, but when you're doing the market, and let's say you're under, it'll tell you it's a sliding scale.
What it is
so it'll tell you won't pay all of it, but you'll pay a portion.
Right, but some states did not. There was what we call the Medicaid expansion. So what happened is if you make under, like in California, the poverty level is for Medicaid under $12,880, and some for a single family. Okay, I'm sorry, it's $18,755. You make under that, you get on Medi-Cal. In certain states, the poverty level for Medicaid is like $13,000. But if you make under that, you couldn't even get insurance. Medicaid, and I know people don't understand this. They did not do the Medicaid expansion. You have to pay for your insurance, and it is so unfair. There are so many things that are unfair in a lot of these things, but for the most part, it has done tremendous good for people who needed insurance and who needed to make sure that they go regularly to the doctor. I had a client call me today, and I have these every day. The person has kidney problems. She hasn't had insurance and she's out of medication. She must have had several months worth of medication. You can't just call and say, I need to get on a plan. It doesn't work like that. Right. If you are not Medicaid eligible, then it goes forward. So you apply today, you've lost coverage, or you experience what we call a qualifying event, it goes forward. Your November 1st is as soon as you can have a policy to be in effect. So what do you do from today to November the 1st? What you did before. And there's nothing I can do unless I can get you a short-term policy, but that's medically underwritten. There are
Right.
other, so it's
So you're stuck between a rock and a hard
too
place.
far.
And here's the thing, for people that are listening to us now, the without a qualifying event or loss of coverage or something like that, you our open enrollment for under 65 is going to start November 15th. It's going to run through January 7th, I think, this year.
No,
They've
it's
ex-
some
they've
states, some
some
states.
things. Well, here in Georgia, it's going to
December
go through
15th.
January. It's not going to stop in December like it normally do. It's going to go through January. But one of the things that I want, this is so very confusing, but we're trying to kind of touch on so many different things, because we talked a little bit about how you could be eligible. Please understand that you are not eligible to go to the marketplace if you have a job that provides insurance for you, not the
Wow.
rest of your family, but for you. And so there were some people that were caught up in this thing where, and let me change that, if they provided affordable
Right.
insurance
Yeah.
for you, right? So if it was if the insurance premium was anywhere under 9 point something, like less just under than 10%, they consider that affordable for you. Remember, the employees do not have to provide for your family. You will have to pay the premium for your family. So some people were stuck not having their rest of their families insured, or choosing to go with the more expensive thing because they had a sick child or sick spouse or something in order to think. So you did
That was
not.
me.
Oh wow.
Okay. So
That was me.
You did not get, and I'm gonna let you share that a little bit more with them, but you could not, you still right now cannot. And a couple of months ago,
We're hoping
Biden,
it changes.
huh?
We're
Now
hoping
we are hoping it changes.
Right.
family good.
Right. A couple of months ago, there were some legislation and things that were going through. We're hoping that's going to fix that. We've been calling it the family glitch. And so that if your family was caught in that, there's another couple of, and I shouldn't say couple, lots of millions of people that are going to be able to get covered, because now, even if you fell in that kind of glitch, your family can now get their insurance through the marketplace. So I wanted to say that, just in case someone was listening to us and going, what? I could have done whatever. I wanted to say that, to understand that that was for people that did not have any insurance. And if you're still in that place right now, you didn't have an insurance, then you do want to get in touch with us, because the annual open enrollment starts in November for you. And so now we can actually get you on without you having to have a qualifying event or loss of coverage.
Correct. This is so important. It's so important because there are dates and times throughout the year that you have to pay attention to. And again, we're talking about people who are under 65. We'll get into Medicare next. Maybe it's a whole nother episode. But if you're under
A whole
65,
12 episodes.
I know.
We're definitely going to touch a little bit on it tonight, though, because it starts even sooner than the under 65. So maybe we should have started with that, but we're definitely going to touch a little bit on it, and then we can continue if we have to next week.
So I'm sure that there's so many people out there that have that fall into that gap, that loophole. So I worked, I had a great job, and so I made really decent money, right? So my insurance was really inexpensive. Well, it wasn't even really inexpensive for just me, but it was doable, right? But when you add on my family, it quadrupled.
Wow.
I'm not even lying to you. So for me, it was going to be $48.57 for the moderate plan. The middle grade deductibles, the decent co-insurance,
we haven't even talked about that yet.
The decent out of pocket. It was, a paycheck, remember? So you're paying twice a month. When I were to add my family, it jumped to, remember I said 83 and some change, $459
Per
a
check.
paycheck. I was paying $1,000 a month in insurance because I had a job.
Right.
Right.
It was ridiculous.
Yeah.
It was so ridiculous because you still have to consider how much you pay when you go to the doctor.
Yes.
I still had a $25 office visit copay. I still had a deductible to meet. The deductible was only like $1,500, but still,
Only, right?
it's still a deductible to meet, you know. That's not counting any, if I see a specialist, what those are. It
Right.
was very inexpensive. That was when I lived in Georgia. When I moved to Missouri, my husband's job brought us here. So I took a pay cut. I didn't have as good of a job or as high of pay.
Mhm.
But then he had the opportunity to have the government insurance that everybody just so loves. Really expensive for the family.
Oh no.
For the family, $520 something a month. Right?
Wow.
So we try the marketplace because in Missouri and Kansas, as long as you can show that it's a certain percentage of your income that would be going to your medical, then you can have the marketplace.
Right.
But they do check. You
Yes,
do
they do.
submit those forms to them. I'm sure someone's sitting there with a calculator to the penny, and you have to wait some time. So I did that. And then guess what happens? We had it for a couple months. My husband got a pay raise because with the government, you move up in steps. And when he got a pay raise, our coverage doubled.
Oh wow.
Not only did it double, they said the plan was no longer available.
Oh.
It was already after enrollment, so I
Oh.
could not just switch to another plan. The deductible went to $6,000 per person.
Yeah. Yeah.
And guess what happened? He already had a surgery scheduled. So guess who had to go into their savings? Good thing she has a savings, right? And pay for that surgery.
Right.
Mhm.
Because
Wow.
even after the surgery, we still did not meet everything. We still had to pay out of pocket. Then you got to pay the specialist. Then you got to pay the anesthesiologist. Then you got to pay for all the follow-up appointments. Then you got to pay for the DME, the equipment.
So this is, if you think you can't afford to have insurance, you cannot not afford to have insurance.
Cross your T's and dot your I's. And I'm a licensed health agent, but I had no way of knowing that it would go up that much just for having a change in income.
Right.
So make sure that you take precautions when you're looking at your healthcare options.
Wow.
Be sure that you cross every T and dot every I, because if that was the case, we would have just done better staying on his employer insurance, which is what we have now. You know?
Right.
Wow. That's a very good story. And that's something that when you talk to a licensed agent, you have to go beyond a dollar premium. So let's go back and talk about the income. What's counted as income? Because they want you to name your income. If you're self-employed, you've got deductions, you've got a lot of things, and Carmen does taxes. But when you are doing your income for the sake of healthcare and getting on the marketplace, you have to make sure that you calculate correctly. There are some things that don't count, and I'll mention those. So you want to make sure, because this is a good thing to me. SSI, you know, that SSI doesn't count as income. Those things are really good, or child support. So if all you're living on is child support
or alimony,
but there was a deadline alimony or divorces finalized before
Right.
2019 include. After that, you don't include. So there's things that happen, you got
Right.
divorced 10 years ago, you got to include that. But here's how it works. If you just live on child support and you have SSI, then you're Medicaid eligible
Right.
in most states.
In most states.
Yeah. Now, if
And
you
you
don't have
know,
Medicaid, you got to pay the premium.
Yep.
yeah, and and here's what happened. Like for instance, like states like you may have heard Aaliyah mention if your state had taken the expansion, and
Mhm.
states like Georgia who did not take the expansion,
They
now you
didn't.
had people. No, they didn't. So now you had people who were under the poverty line
Yep.
and they couldn't qualify for insurance. But this is why you listen to people like us. So let me explain what happened. You couldn't qualify for the insurance because you had to make at least at that poverty line to be able to get. And if you were there, you got maximum subsidies, and now your insurance was affordable. But let's say you were under. Let's say you were at 12,000, and that thing was 13 or 14,000. Then what they told you is you qualify for Medicaid. But in the state of Georgia, unless you were pregnant or suffering
Yeah.
from kidney disease or something like that, you were not getting on Medicaid. So now you are running around without insurance. But speaking to us will tell you, if you only make 12 or 14,000, can you walk a dog?
Yes.
Can you
Uber.
babysit?
Yep. You better
Can you
become a gig worker.
you need to do something to bring in that extra $1,000 or $2,000 a year, and now you qualify. You
Yep.
just have to report that income to the government so that you can be taxed on it.
Yep.
But it's way
love
better than walking around without insurance. It hurt my heart to read the other day where a family was without insurance, and then the father, the breadwinner, fell or had something bad happen to him, and they ended up having to have like a GoFundMe. And what was bad about it, when I read it, I knew these people
Oh,
personally. But see, this is why we're doing this and talking right now, because you might not have, that I do Medicare. You may not have known that I'm doing the ACA or Obamacare, but we are resources. If we don't do it, we can connect you with someone that will help you.
And that's the thing, Carmen. I think sometimes our friends and family don't necessarily want to come to us. Not that they don't feel that we're trustworthy, but sometimes maybe they think that they're embarrassed by their situation and they don't want us to know. But that does not mean that because you call me, if you don't feel comfortable working with me, that I don't have a colleague. That's exactly why there's a team of us. And we all overlap in experience and expertise, so that if you are too close, I can give you to one of my counterparts, because the ideal is to have everyone insured.
Exactly.
Since you were talking about taxes, Carmen, I want to talk about something really quick. It's kind of funny, kind of not. So some of these people that did the PPP loans, they put their businesses, and their businesses made so much money, right? So that they could get that money back. Well, then guess what happened? And these are chronicles from when I worked at the IRS. So this is kind of cool. So guess what happened when we go?
They ain't qualify no more.
They ain't qualify no more. And now guess what else? Their premiums increased because they made so much money. So guess what else? Now they don't have insurance because they really didn't make all that money, and they can't afford the new premiums. People, what did your mom used to tell you? When you tell a lie, you got to tell a bigger lie to cover up the first lie you told.
wow.
Stop playing with these acronyms and name money. That's all I want.
Right. But no, I'm glad you said that. But here was another conversation that I had with someone who, if you're a business owner, by the way, you can estimate how much you will make. So even if your business is new, or even if you have, how much you think you're going to, you can estimate. So if you say, okay, I'm going to make 50,000, right? you're not going to be penalized if you don't make the 50,000. You may get penalized if you make zero or something like that, where you wouldn't have qualified for any credits, or you may be penalized if you made a little bit too much. So now you may have to, some of that credit needs to go back. But the lady was like, well, I don't want to be penalized. What if I make $250,000? I said, then you could afford to pay for the insurance. So are you going to not make $250,000 because you're scared that the government is going to take back $1,000? What kind of craziness is that?
But you already know the answer to that, so I don't even know why you asked.
But then she was like, oh, no, some people really don't think. They think of penalty, the word penalize, the word what if, oh my God, so what? Because now it's like the lady that's, I was speaking to a lady that's trying to sell a home. And if you guys know, both of my kids are real estate agents. And so she was talking to me, and she was represented with my son before, right? He had made sure she was protected and this and that, whatever. Then she decided she was going to go do it again, but she did not call me. I don't know. She didn't have my number or whatever, but we got to talking about it. So I told my son said, let her know, I'm available if she wants to represent it. She was like, but if he makes me get more money, I'm going to have to pay more taxes. I'm like, Jesus Christ.
Girl, preach, girl. Another insurance agent, a fellow insurance agent that made a killing last year. And she's going to watch this and she's going to be like, oh, you called me out.
Oh, we're not saying her name.
She was like, Shay, you need to look at my taxes and we need to do an amendment because that girl that I went to, she did something wrong. I'm like, what did she do wrong? And she's like, you know how much I had to pay in taxes this year? So I said, send it to me. She said to me, I said, look at how much money you made. You cannot complain about paying the taxes and you done made all this doggone money. She's like, well, I said, you still got the money. Girl, she got the money in her savings account. What is wrong with you? You're an insurance agent. You know better.
Oh my gosh.
Wow. Pay your doggone taxes and roll that money into something. Stop being selfish. Boy, I tell you, people.
Interesting. Well, you know what? We have, this has been so much fun. We only have 10 minutes left. So we still haven't gotten to a lot of the information that I want to talk about.
I told you this is going to be a 12-part series.
This has to be.
We need to break it down next week on co-insurance.
Well, I want to touch on, we were still talking about what you have to do, what income. When you are a family and people, we have to understand this because when we were taking calls and people were calling in and they needed insurance, they didn't want to file taxes with that old guy over there, But if you get a subsidy and you marry, y'all gonna have a problem. So you have to be aware of what you need to do. Then if you sell a house, if you make a lot of money, they're going to make you pay some of that subsidy back. So you want to make sure. And how they do it is when you file your taxes. So when you file your taxes, so this is 2022. If you have an insurance policy or through the marketplace, we're basing your premiums on 2022 income. And if you are in the guidelines, so in California, a single person can make up to $51,000 and get a subsidy, a tax credit. That's excellent.
That is excellent.
I'm going to do a quote, but then we didn't talk about how they structured the insurance plan. So before the structure became final, where you have 4 categories. So there are 4 categories of insurance, metal categories. Why they did metal, maybe it's because we all like jewelry. So
like metal. So if they're looking for it, sometimes it's called metal levels.
Metal levels, right. So there's bronze, silver, gold, and platinum. Now, what does all that mean? Bronze, why they chose bronze to be the most high deductible and the most high out of your pocket for the family, I don't know. But if you choose a bronze plan, it could be a 0 premium. It could be $1 premium. And a lot of people right now today, I can get you a 0 premium bronze plan if your income is under the poverty level of what we call 150%. That creates an open enrollment. You can enroll. That's what the the act did that Biden put into place. That creates an open enrollment. But bronze, you can a deductible. I've seen the deductibles are like $8,300. That's
Yep.
day one before a copay, before anything. So just because it's zero doesn't mean it's the best for you, and that's why you need to talk to a licensed agent. Silver plans, there are several levels inside the silver based on income.
Right.
So I love that. If you are in that silver level and you get a silver 94, you've got gold. You can't go outside of the marketplace with that silver 94.
Right.
I love it.
But you know what needs to happen is we need to send a letter to the administration, and we need to let them know that there are more than too many of these counties and zip codes that are stuck with just bronze plans, and that's not fair. That's just my little tidbit.
Take a guess. Take a guess at what kind of people live there.
No. We're not going to take a guess because we like our StreamYard. We like our StreamYard.
I'm sorry. I'm sorry. I'm not going to tell you who are stuck with those plans.
Shut her mic. Oh, we don't have technicians yet, do we?
Okay, all right. So there's bronze, which is a high deductible, a lot of money out of your pocket, but at least if you have a heart attack and you go in the hospital, you're covered. Okay.
Right.
Silver, you have a lower deductible, a little less out of your pocket, and inside the silver, you have 3 levels.
Right.
That the government says, I'm going to pay part of your deductible. Okay. Then there's gold. Most of the gold plans, and I notice when you're quoting in different states, some gold plans have a deductible.
Right.
Like, why? But it could be $100. It could
don't
be
ask Carmen why.
You know, it's interesting.
No, but for real, for instance, I can't say who it is, but because people will know. But what I'm saying, a client of mine that was making, over $50,000 before they made the changes where they made it a little bit more affordable, they had to come out of their pocket like $800 a month. Now, of course, we chose the plan that was best for that client, and we chose a gold plan because you know why. Shay just told you. But once they did that same person with that same $55,000 was able to get a plan for $159 and get that same gold plan with a $500 deductible.
Right.
But regardless, guys, if you can only get the dollar plan or the zero plan, get it, because the only thing you'll have to worry about is that $8,300, because $8,300 is not what it's going to cost for you to get treated for a heart attack or a stroke. Right. Okay.
Now, in our situation, you're right, because in our situation, we would have actually been fine if my husband didn't have that surgery, but he had to have that surgery. Right. But had he not had that surgery and we had that plan that we didn't want, but that's the only plan that's available in the zip code, so we had to have it.
Wow.
Then, and something else that we didn't discuss on the life-changing events. You know what those plans, if I moved zip code, it would be considered a life-changing event. It's not like that with an employer plan. With an employer plan, it's like that if you're military and you're moving duty stations, because of course there's going to be different providers there. But it's not like that on the employer plans as far as moving a zip code being a life-changing event, because you're still in the same state.
And because there's different plans,
right?
Different zip codes. Now, one good thing about a bronze plan, I'm not saying it's something bad or negative. All the plans must cover preventive care.
Exactly.
So that's the good thing.
Yeah.
You need women. You need breast cancer. This is Breast Cancer Awareness Month.
Yeah,
that's right.
Women, you can get your mammogram. Men, I've been doing research because I'll be posting things about breast cancer and cancer in general this month. But I've been doing research. Men get breast cancer too.
Yeah, they do.
And prostate cancer.
Yep. They get prostate cancer a lot now.
cholesterol, high cholesterol, heart attack. When you go to your doctor and do your preventive and take your x-rays, your EKGs and things like that that the doctor recommends, colonoscopy,
Mhm.
believe me, I know this because every time I take a colonoscopy, I have polyps.
Yep.
So you never know. And what we eat, what we do in our environment,
Mhm.
it could be the water, it could be where we live.
Mhm.
They build houses on top of landfills. You don't
Right.
even know it. There is
Right.
gas that is leaking out of whatever the ground. You don't know, and it's environmental. Cancer is real. If you go take your preventive, you can catch that.
You catch it early.
Catch it early. You have a chance to survive.
And then if you see us, we'll get you covered in all different areas because we'll get you a supplemental plan that'll pay you when you go for those treatments.
And those living benefits.
As, right, especially Aaliyah. She's got you that those indemnity plans, man. She
Mhm.
could tell you a lot. That'll be another whole show. But you know what? Those preventatives, you're typically able to go without having to pay that
Right.
deductible.
Right.
Or sometimes you don't even pay the copays for preventive.
Right. But I saw an article, a lady was too young to get her mammogram. A doctor said, nope, you're too
Right.
young. And
Mhm.
it's been all over the internet. And then she had like stage something breast cancer. And she is advocating for the doctors, the medical community to allow women to get the mammograms early. And
Yeah.
sometimes mammograms won't even detect breast cancer.
Right.
Know that. So
Right.
there's so many things you have to do your preventive. Women, my sisters, please do your preventive because you don't know if there are polyps growing in your body. And
Especially if you have a history in your family, which is
yeah,
why they ask about medical history, especially if you have a history in your family of cancer of any kind,
mhm, mhm. So this has been so wonderful. We just touched the basis on the types of plan, the four types of plans, and maybe on another episode we'll talk about the details of how to choose a plan, what you're looking for. Do you go to the doctor a lot?
I
Do you
think
want to
that's
keep your doctor?
important, because somebody that doesn't go to the doctor very often, or only goes if there is emergency, can afford to have a higher deductible and pay a lower premium because they're not. So I think it is important for us to do something on that to help
Okay,
people
so we'll
decide.
do a
And
deep dive.
you know what? It's okay that my eyes look so much bigger with these reading glasses that I have on, but they're cute.
They are cute.
but but look, my eyes are not that big for real.
But
There we go.
those glasses.
But what I want to say is this was really a very important topic, and like we said, we really did not scratch the surface. We really hope you have learned a lot from it. But next week, since that's going to be 2 days before the open enrollment for Medicare, please join us because you may not be 65 as yet, but your mom might be, your
Yeah.
grandmother might be, your
And
aunt
we
might
need to be helping
your
our people
father
that are
might be.
65 and older. We need to be really helping
Yeah.
them to navigate through that because Medicare can be a lot. So
Mm.
imagine being 65 and not knowing.
Right.
Help your elders out. Well, 65 is not really elder, but help your mothers, help your grandmothers and your grandfathers, help them out with picking these plans.
And you know what happens? Here's one of the things that happens. A lot of times because we are accustomed to having just one plan or maybe two plans at our jobs. When we come out here and we get a plan, we kind of stick with that plan forever, not
Right.
realizing that the changes,
Yep.
sometimes those plans don't match or suit us anymore. So just like life insurance, when you talk to somebody, it's like, oh, I already got life insurance. Oh, I already got a Medicare. I already got a Medicare plan. Oh, I already got I got a Medicare Supplement Advantage plan. I I got a term permanent policy. These
You
these
got
are
a
the
who?
things.
You got a who? I need
term permanent policy
I
that
need
will
to know the agent that gave you that.
that will continue until I'm 95. I can guarantee you do not have a term permanent
That's
policy.
those plans that they pass away and they have $5,000 and still doing a GoFundMe.
Oh
Not
Lord.
even 5,500.
Yeah.
But what
500.
I'm saying is that just because you've done, it's not one and done. Medicare is not one and done.
Right.
Life
And there's
insurance
updates to Medicare every year, new
every year.
plans, changes.
Right now, and every single person that's on Medicare should have received a letter by law called ANOC, the annual change. Something changes. What is
Yeah.
it? Help me.
Something changed.
ANOC.
Something.
The ANOC, they call it ANOC.
ANOC.
And as soon as you pull it out the envelope, you will see that. Here's the thing: most people don't pull it out because they see Medicare.
Pull it out. Don't
Because
throw it away.
they've seen, they're bombarded, and I understand. I really do understand. You're bombarded by people calling you. You're bombarded by the television commercials. You're hoping that it becomes December 7th so that it could stop. And guess what? It continues. And
Carmen, but that's why we're bombarding them, because this is very important and we want them to get the best plan. So when the Millionaire Ladies Mob calls you to make sure that you're able to renew for your Medicare, answer the phone.
Well, first, let me tell you, the Millionaires Ladies Mob will not call you unless you invited us to call you.
Exactly.
And if people are calling you about Medicare, hang up the phone on them, because they're not supposed to be calling you unless you personally told them they could call you. And we would like you to go to the Millionaires Ladies Mob and tell us to call you, because friends do not let friends buy Medicare from JJ. I said it.
Oh my goodness, you got, or what's his name? The other one.
Stop.
Weymouth, right? No, they don't.
JJ, dynamite. That plan gonna be dynamite.
Because it might pay for your medicine and it might not.
Oh, we're having too much fun. Oh my goodness, it's been an hour. I'm in tears right now.
Right. Well, we need to know, these are things that you need to feel comfortable with the person that's, helping you to navigate your finances, right? We're down to earth people. We're, like I always tell you, our audience, at the Millionaire Ladies Mob, we work off ethics. We have fiduciary responsibility to be sure that we're doing the best by you. We will never harm you. If the plan that you're currently on is a better plan, then we'll just simply tell you to renew it.
That's right.
We will not harm you.
That's right.
But we're going to make sure that you have what you need, because we want to make sure that you're insured. We want to cover you in all aspects of your life affordably.
I'm going to give you something. Listen, I've gotten so many emails and messages of people that call me angels. We are actually angels for real because of what we do. I spent about 4 hours on Thursday with a client that did not even have a Medicare card. But you know what? I thought from what he explained to me that he needed to have one. He should have had one. So I spent that time. Most of these people that are calling you on the phone, if you don't have that card, they're not helping you. Right. And here again, don't ever give them any kind of information when they're calling you. Don't give them your MBI number. Don't give them your health care plan number, because they can never have that. They may be able to figure out your MBI number, but do not give them any of that information, even if they swear that they are calling you from Medicare or from wherever, because Medicare always communicates with you by mail. So they will not call you. But I sat there and I helped this client and tried to get where I thought he should have been. And in the end, we realized that he needed to go down to the Medicare office. Most agents would have walked out of
Yep.
there and go, I can't, I
Yep.
could be making money right now. And that's not how.
What do they say? I don't do anything that don't make me money. Well, okay.
Right. And that's
What
not
was the
how.
outcome of that, Carmen? What happened to him?
That's not how we operate. I called him today. Hey, did you get a chance to go down to the office? He said, my God, you are the smartest person I've ever met. I'm going to have my card in 7 to 10 days.
Oh,
This man,
how much did you pay him to call you smart, Carmen? Tell us the truth.
I did not have to pay because, like my granddaughter says, I am smart. I am an angel. I help people. I am a millionaire ladies mob sister.
All right. All right. So okay. And see, that's another episode. I love it because you helped it. He was disabled all these years and didn't have
years. He should have had it already. He should have.
But see, people don't know what they don't know.
People don't know what they don't know. People do not know that they may qualify for so many programs that are out there, but they this, I already have that. Listen, people, stop turning down the benefits that you deserve because you've been paying taxes. You complaining. Now let us help you.
That's right. Stop listening to Uncle Betty and Aunt Betty and Uncle Sue or whoever you listen to and cousin over there because they don't know your situation.
They're not a professional at it. They're not the professional. Go to a professional. If you have something wrong with you medically, you don't go to your sister. You go to the doctor.
That's right.
We're your healthcare advocates. We're your finance experts, right?
So don't go to the teller at your local bank for financial information.
They're there to take your money and give you 0.25% while they hold it.
Wow. This has been so good. I think we better wind it down. We've been over an hour. We've never gone this long, I don't think.
Girl, please, we have gone this long. We have.
Okay. All right. So
but yeah, it is. Huh? Is there anything that we didn't specifically get to cover?
Well, I just went over the plans, and I wanted to do a quote. I wanted to go over the details of an actual, the plan summary, but we can do that on another episode.
And you know what? And right. And the fact of the matter is, we still kind of give them an idea of how someone that made more money, how much less they could be paying if they spoke to one of us. And it is just that we are talking to people all over the United States, and it's just so different for each and every one of you. So you do need to reach out to us. We're going to be back next week, and we're going to give some more general educational information because, guys, we are not your financial advisors. We can be, but you need to contact us so that we can analyze your specific situation and make sure that you are getting exactly what you need and making sure your needs are met and you're satisfied.
Yes, definitely. Customized solutions specifically for you.
Right. So we're here just
in your friends and family's household may not work in your household.
That's right.
So reach out to us. We are at millionaireladiesmob.com. We are on YouTube. You can, if we've covered a topic that you'd like to know more about, scroll through our YouTube and see if we've already covered it. If not, you would like us to talk about it, reach out to us. Hey, we're up for some suggestions.
Yes. And you know what? We do Medicare 101s. We do health insurance 101s. I have one scheduled tomorrow for one of my large groups, all their employees, because it's so timely and so important. We really care because that's the business that we're in. We're in the caring industry. This industry, there are a lot of people who really don't care. All they think about is the money, but that's not us. We make sure I will talk to you for 2 or 3 hours if I have to. I'm not making a lot of money talking to you for 2 or 3 hours, but guess what? If I know that you've been taken care of, I'm happy and I can sleep at night. If I don't take care of you, I can't sleep at night.
No, we'll be worried about it. We'll be calling each other.
That's right. So we're going to sign off. And did you do your outro, Carmen? You did yours too?
I don't think we did it, but guys, you can reach us at millionaireladiesmob.com. And then from there, you can reach any of us. We are so happy that you joined us tonight. Even if you catch us on the replay, please just share the video. you may not need it for yourself, but somebody else needs it. We want to get this information out to as many people, and we need your help in getting this out. Just share the video, go back through our old videos and just hit share. It takes less
That's
than
right.
a minute, a few
That's right.
seconds. Just hit share, and share it to your groups. Somebody may need to hear it, your churches. We talk to churches, we talk to organizations, we do Medicare 101s, we do finance 101s, how money works 101s, budgeting 101. We do all of these things, and we do it at no cost to you. Thank
That's right.
you.
That's right. So thanks everybody. We will see you next week. Millionaire Ladies Mob, and good night.